I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. For heart attack prevention, cardiologists have focused on cholesterol. Should they also consider anger and hostility? This is the People's Pharmacy with Terry and Joe Graydon.
Research has demonstrated that negative emotions can have a profound impact on vascular physiology. The effect can last for hours.
There are lots of risk factors for heart disease: LDL cholesterol, triglycerides, Lp(a), and hypertension. Hostility and anger also belong on that list.
What can we do to change our attitudes and behavior so we're not at the mercy of negative emotions? How can the phrase, "I am worth it," help?
Coming up on the People's Pharmacy, why does anger harm your heart?
In the People's Pharmacy health headlines, lead is a toxic metal that can cause a variety of health problems if it's found at high levels in water or food. Last year, some children experienced lead poisoning because they consumed applesauce flavored with cinnamon that contained high levels of the metal. Now, the independent testing organization Consumer Reports has found high levels of lead, above 1 part per million, in a dozen brands of cinnamon. That's a third of the 36 brands it tested. The highest levels were found in Paris, EGN, Mimi's Products, and Bowl and Basket ground cinnamon. Some brands of five-spice powder, which contained cinnamon, also had unacceptably high levels of lead. These products should all be discarded rather than consumed for safety's sake. Consumer Reports testers identified 365 Whole Foods Market, Morton & Bassett San Francisco, and Sadaf as brands with the lowest levels of lead. James Rogers, Director of Product Safety Testing at Consumer Reports, suggests choosing spices with the lowest levels of lead. The danger is highest for young children, especially if they're consuming cinnamon frequently.
No one knows how many Americans are suffering from symptoms of long COVID. The CDC estimated in 2022 that roughly 7% of adults had experienced this debilitating problem. That would be about 17 million people. There's no known cure, but researchers have been evaluating a number of treatments. Israeli scientists recently reported the results of a randomized controlled trial of hyperbaric oxygen therapy. In this intervention, patients spent 90 minutes in a pressurized chamber containing 100% oxygen. People in the control group spent time in the chamber at 21% oxygen, which is the normal amount of oxygen in our air. There were 40 sessions in the study. When the volunteers were contacted after a year, they reported less pain, better sleep, diminished brain fog, and overall improved quality of life. Hyperbaric oxygen therapy is considered experimental. That means it's not covered by insurance, and it is expensive. A 6-week course of therapy could exceed $60,000. More research will be required before doctors accept this intensive treatment for long COVID.
Young children have been developing pneumonia due to Mycoplasma pneumoniae. The proportion of patients at emergency departments with lung infections due to this bacteria has been increasing for the past 6 months. This is a common cause of respiratory illness, especially walking pneumonia. It has become increasingly common, especially among young children between 2 and 4, rather than the teens and older children who previously were the most common patients. Like other respiratory infections, such as the flu, M. pneumoniae is spread by coughing or sneezing. Doctors usually prescribe azithromycin to treat it once it has been correctly diagnosed.
Strokes impact more than 500,000 people every year in the United States. New guidelines for stroke prevention suggest that the number could be dramatically reduced if doctors and patients implement screening and lifestyle changes. One recommendation is to follow a Mediterranean-style diet. The committee encourages more nuts and olive oil as part of this dietary pattern. Regular physical activity is also a crucial aspect of the guideline revision. The guideline writing group also emphasized the importance of maintaining a healthy weight and suggested that some people may need support from GLP-1 agonist drugs such as semaglutide or tirzepatide. That includes Wegovy and Zepbound. Blood pressure control, blood sugar control, and cholesterol management are also essential. The chair of the guideline committee concludes implementing the recommendations in this guideline would make it possible to significantly reduce the risk of having a first stroke. Most strategies that we recommend for preventing stroke will also help reduce the risk of dementia, another serious health condition related to vascular issues in the brain. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. If you ask most cardiologists about the risk factors for cardiovascular disease, you're going to hear about LDL cholesterol, first of all, with high blood pressure close behind. There's no doubt that these are important contributors to heart disease.
But there are a number of other factors that also contribute in a major way. Doctors often mention physical activity. You've probably heard the expression, sitting is the new smoking. And of course, smoking is still a major risk factor for cardiovascular events. One that's rarely mentioned, though, is temperament.
People who are frequently angry or hostile may also be at higher risk for heart attacks and strokes. A study published in the Journal of the American Heart Association last spring was titled Translational Research of the Acute Effects of Negative Emotions on Vascular Endothelial Health, Findings from a Randomized Controlled Study.
To learn more about this research, we turn to one of the investigators. Dr. Matthew Berg is professor of medicine in the section of cardiology at Yale School of Medicine. He's author of the book, Psychological Treatment of Cardiac Patients.
Welcome to the People's Pharmacy, Dr. Matthew Berg.
Thank you. It's a pleasure to join you.
Dr. Berg, in the 1980s, there was a lot of concern about something called the type A personality and its relationship to heart disease. And I remember articles and TV shows about the highly competitive, ambitious, work-driven, time-conscious, aggressive personality. And then along came Dr. Redford Williams and his colleagues at Duke, and they reported that hostility and anger were actually the primary drivers of cardiovascular damage. Now, it's my understanding you've continued this research. So what is it about anger and hostility that's so bad for the body?
Well, so there were two kinds of studies that were done, growing out of the type A behavior pattern research. One was looking at people who displayed certain ways of behaving or expressing emotion when frustrated, and then what would happen to them subsequently. And that research showed that people like that were more likely to develop heart disease and die younger of heart disease. We also then took that research into the controlled conditions of a laboratory where we would have people talk about situations that had caused them to become angry. And what we found there was that when they were describing these situations, the body was evidencing a strong stress response. So we were seeing profound increases in heart rate and blood pressure. We were finding increases in the level of circulating stress hormones in the blood system. And interestingly enough, when we were doing these studies with patients who had known heart disease, blockages in their coronary arteries, when these people, about half of them, when these people were describing these events that had made them angry in the past, they were showing decreases in blood flow through the coronary arteries, which is akin to cardiac ischemia, like when a person gets angina or chest pain. Interestingly enough, when patients were experiencing this during the description of these angry episodes, they were not having any symptoms. Yet at the same time, their heart was compromised because of this reduced blood flow. So the anger, especially the expression of that anger, really is associated with all kinds of negative effects on the body, particularly the heart.
Dr. Berg, you were recently part of a research team that published the results of a study in the Journal of the American Heart Association. Very interesting study, and I hope you'll tell us about it.
Yeah, so this was also a study where we were still trying to understand what it is about anger and whether anger is distinct. And this was a study that was headed up by Dr. Daiichi Shimbo, a cardiologist at Columbia University Medical Center. And what we were doing was similar to what I was just describing. We were taking healthy people and bringing them into the laboratory setting, and we were having them do that anger recall task. Some people did the anger recall task. Some people recalled a situation under which they experienced moderate to extreme anxiety. Other people, we were looking at the effect of sadness, and other people, a neutral condition, because we wanted to see whether it was strong negative emotion in particular or whether there was something specific about anger. And here, too, we found that there was something specific about anger, that anger specifically compared to these other negative emotions had these negative effects on the circulatory system.
Can you describe what you mean by anger recall or provoked anger? What's actually going on, and how long does the effect last?
Well, so what's going on is the instruction to the research participant is to recall an incident that occurred recently in the last several days or weeks or so, an incident that caused them to become irritated, aggravated, or frankly angry. And then to describe that incident in detail with prompting for the details that were anger provoking. And so that's what we call an anger recall task. And typically we engage the participant, the research participant, for somewhere between 5 and 10 minutes talking about this incident. And it's during that time that we see these profound changes in the stress response systems and what I would call the downwind effects on major body systems like circulation, like on the heart. And so when others have looked at this, and as we looked at this period, even after the description of the anger-provoking event is completed, and the person is then just what we call a recovery period of up to 2 hours, we see that these effects on the body persist for 30, 60, up to 90 minutes. And this is interesting when taken into consideration with a study done in the 1990s looking at triggers of a heart attack. And one of the triggers that was identified was the experience of moderate to extreme anger. And the experience of anger of that level was associated with a 2.5-fold increased risk of a heart attack for up to 2 hours after the experience of that anger. And so that observational study gave rise to what we were looking at in the lab, and the results in the lab mirror what was seen in those observational studies.
Now, what were you measuring in the lab to tell you that the anger was having an impact on the cardiovascular system?
Well, so in the study of Dr. Shimbo's, we were looking at the effects on the vascular system. So particularly what we would call the function of the part of the vascular system that's responsible for dilating and constricting the blood vessels. These are the endothelial cells or endothelial function. And this becomes impaired. And this has been seen as the earliest stage in the development of coronary artery disease. That endothelial dysfunction, which can be caused by smoke a cigarette, eat a high-fat meal, but it's the repeated insults to the system that eventually leads to atherosclerosis.
Well, it sounds like the book that Dr. Redford Williams wrote almost 3 decades ago, titled Anger Kills, was on target. That when somebody is what we would call an angry person, oh, you cut me off in traffic, you SOB, and they get really excited and they carry that anger with them, to work and halfway through the day. And it sounds like this kind of a person is experiencing cardiovascular challenge throughout their life if that kind of experience is frequently repeated. Was Dr. Williams on target?
Yes, absolutely. And this is one of the ideas about how stress over the period of one's life is a factor that contributes to the development of heart disease. And as you described it, it's that repeated occurrence. Now, everybody gets angry about something that happens. The difference is between those people who hold on to that anger or relive it. So, as someone who actually performs these types of experiments, one of the things I've noticed over the years is some people, when they tell you about this incident that occurred previously, it's very clear that they are once again angry. Their face is flushed. You can hear it in their voice, in how quickly they talk, in the volume of their voice, in the pitch of their voice. Other people, they're telling you about it, and it's very dispassionate. It's like this thing that happened, and it's over. And they're just describing, oh, yes, this happened 2 weeks ago. I was trying to get something done, and I kept getting interrupted by my neighbor asking me inane questions, and I was getting really, really angry. And that's kind of what happened. And that's a person who doesn't show those same profound changes in the stress response systems and the downwind effects on the heart and the circulation. So what Dr. Williams was describing is that person who carries hostility about situations in life and is more prone to respond to these frustrations, these provocations, these daily things that happen to everybody, but it is more prone to respond to them with anger and holding on. That anger continues to live for them. It's like one event after another that has a common theme about life and life being challenging and the people in the world who make it challenging. And if not for them, it wouldn't be this way, so to speak.
You're listening to Dr. Matthew Berg, professor of medicine in the section of cardiology at Yale School of Medicine, author of Psychological Treatment of Cardiac Patients.
After the break, find out how we should apply the lessons from Dr. Berg's study.
Do you know when you're angry? Do you need help identifying your feelings?
How would a psychologist counsel a cardiologist to help patients?
We'll also talk with Dr. Redford Williams and get his perspective. You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is brought to you in part by Air Doctor Pro. Air quality matters, not only for allergies, but also infections. We need to filter out unwanted particles from the air we breathe.
Most of us spend a lot of our time indoors, maybe as much as 90%. But our indoor air may be more polluted than we realize.
One way to filter out viruses, allergens, pollens, pet dander, dust mites, and mold spores is Air Doctor, a powerful air filter.
We've been using it for weeks, and we love it. It's in our bedroom, and it keeps the air clean and fresh.
There are 2 kinds of filters. An ultra HEPA filter, along with a carbon gas trap filter that captures volatile organic compounds.
Best of all, Air Doctor comes with a 30-day money-back guarantee. If you don't love it, you can send it back for a refund, minus the shipping.
Go to airdoctorpro.com. Use promo code PPOD to get up to $300 off your air purifier. Podcast customers get a 3-year free warranty on any Air Doctor room purifier.
Go to AIRDOCTORPRO.com and use the promo code PPOD.
That's airdoctorpro.com, promo code PPOD.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by CocoVia dietary supplements. CocoVia Memory Plus is formulated with 750 milligrams of cocoflavanols, a level clinically proven to improve 3 different types of memory and support brain function. More information at cocovia.com.
Today, we're talking about how negative emotions can impact heart health. We've just heard that anger can interfere with blood vessel flexibility for a few hours. What are the implications?
We're talking with Dr. Matthew Berg, professor of medicine in the section of cardiology at Yale School of Medicine. He's author of Psychological Treatment of Cardiac Patients.
Dr. Berg, how can each of us take a lesson from the research that you've done so that we can live in a healthier way that doesn't put our cardiovascular system at so much risk?
Yes, that's a great question. We can think in terms of different stress management techniques that people can use more regularly so that perhaps they may be less likely to respond to situations in this way. We can think in terms of different relaxation approaches. I think one of the most important things is self-awareness. And, I think it's great that we started this interview by you referencing what I call the type A behavior pattern, but what you call type A personality. And, back at the time that type A was a major focus of research, there was the group out in California, Ray Rosenman and Meyer Friedman, the 2 cardiologists who had formulated this concept, did a clinical trial. They developed a treatment. It was group-based. It was, these group sessions that happened weekly. They were about an hour and a half. They included some degree of, relaxation exercise. But one of the most important things they found was that people who engage in this way of behaving don't have that level of self-awareness that's necessary for a person to go along a path of behavior change. To the person who's responding that way, their response seems to them absolutely justified for the circumstance. And they will make all kinds of justifications. So the first thing is to recognize that whether justified or not, it's not good for your health. And to then become aware of what are the triggers? Why are those triggers? What's going on in your head? What's that conversation going on in your head about that situation? How can you disarm that? So there's part of it is sort of like learning a new kind of self-talk about how important is this in the total scheme of things, given the things that are most important to you, typically, family, having a good life, the values one holds. In relation to those values, how important is this being, cut off on the highway or somebody breaking in line or whatever the event is that provokes the anger? How important is that in the global scheme of things? And when you start to take an approach like that, you can sort of say, yeah, actually, this isn't as important as I'm making it. And that's a way to sort of disarm it and to let it go, to let the anger go.
Well, now, Dr. Berg, one of the things that our listeners have heard from me for decades is the idea of a mood ring. And I know it sounds silly because it goes back to the 70s, but there are people, as you've described, who don't realize that they're getting really angry and they just want to spank somebody or they want to scream and shout. It's like you said, it's just their normal reaction to being interrupted or cut off in traffic. But a mood ring that changes color when you're under stress, perhaps when you're feeling angry, might be a way of tipping people off. And now we have smart watches that can tell us what our heart rate is and some of our other biological metrics. So I'm just wondering if we need to integrate some of the technology that's beginning to exist and then interrupt it. Because you've mentioned, things like maybe having some anger management skills and some behavioral therapy and some relaxation techniques. But I'm thinking, breathing. And there are now apps on phones that help people slow down their breathing. Or maybe self-hypnosis, of course, hopefully not when they're driving, or meditation or mindfulness training. So help us understand how people can be more aware of their anger reaction, and then how do they intervene, not next week or next month, but at the time?
Yes, absolutely. And I think all of the things that you mentioned. So we can think of, all this new technology, smartwatches and the like, as the new mood ring, as a way to become aware of what's going on with your body. And, even with these watches, you can set alarms. Like if I'm sitting and driving, or I'm sitting at my desk, or I'm not engaging in real physical activity and my heart rate goes up, there's a reason for that. And being tipped off, I can set an alarm that if my heart rate goes up above X when I'm not being physically active, it should notify me. And with that notification, it's an opportunity to reflect. And as you say, to engage in a breathing exercise, which is, a very, very good way of relaxing, doing diaphragmatic breathing, that sort of slow, deep breath and a slow exhale. And as you say, there are apps for pacing one to do relaxed breathing. And then something, that one could use more generally as an everyday practice. And there are apps for that as well. So, in a way of thinking about it, it's the new biofeedback that the watch gives you information about what's going on with your body and then gives you the opportunity to engage in a practice to restore your body to a more relaxed state. And it lets you know how well you're doing that.
Dr. Berg, you're a psychologist. You interact with a lot of cardiologists. How can a psychologist help a cardiologist help his or her patients?
Again, that's a great question. And, the way a psychologist can help a cardiologist with their patients is by working with the patient. What I have found over the years is that while many and increasingly cardiologists recognize that these are issues that are important for their patients, at the same time, the way cardiology is practiced doesn't leave the opportunity for the referral to the psychologist or for a psychologist working within the cardiologic milieu, sort of like a team approach to care. That's an approach to care that's increasingly occurring in the primary care medical setting, where you have teams of multidisciplinary practitioners. You have the physicians, you have advanced practice nurses, you might have dietitians and pharmacists, and a psychologist, all there within the practice setting. Depending on the care needs of the patient, each of them is able to lend their expertise. And in particular, the psychologist can help the other members of the team be more effective with the patient around their chronic medical conditions. This is not really the case in the cardiologic setting, though there are some practices around the country that are moving in that direction, and one hopes increasingly that will be the case. especially since these are factors that are so important to the management of heart disease, especially for those patients for whom things like strong negative emotions like anger are part of their risk.
Dr. Berg, when cardiologists think of heart disease, they think, I think, first and foremost about LDL cholesterol, low density lipoprotein cholesterol. And they're starting to think about other risk factors, biological, like LP little a and triglyceride levels and VDLD and all kinds of markers that are found often in the bloodstream. They don't generally do a test for hostility or anger. And so they may not even ask their patient, are you an angry guy? Do you get mad when somebody cuts you off in traffic or interrupts you during a conversation? How do we begin to help cardiologists recognize that there are a lot of biological factors that are beyond cholesterol that may affect, stress hormones like norepinephrine and epinephrine and cortisol, so that they can begin to what we'll call prescribe anger management and consult with health professionals such as yourself?
So that's a great question. Part of what the way practice of cardiology is influenced is by consensus panels and white papers and practice guidelines. And in all of those venues in the last, let's say, 5 or so years, these are some of the factors that have been identified. The problem is that how to incorporate this into clinical practice is not that clear. So even most recently, when the American Heart Association expanded from 7 to 8 their list of essential elements for heart health, they considered adding psychological health. But because the measurement of it in the clinical setting, it wasn't that clear how to best accomplish that, they decided not to include it at this time. I think that's part of the issue, is how do we incorporate this into the busy context of clinical practice? And we responded to that most recent AHA Life's Essential 8 report, suggesting ways that these psychological factors could more readily and easily be assessed in the clinical setting with much in the same way you do a lot of things in medicine, with a 1 or 2 question screening that, depending on the response, leads to a few more questions. Increasingly, we're seeing physicians do this, and I'm sure you've had the experience when you go to your own physician. They screen for depression, and that is now routine. Similarly, screening for alcohol use. And one assumes that, given what the Surgeon General has been saying recently, that we will find a way to screen for loneliness. I think the issue around anger is partly will, that there will be the will among the cardiologic community to begin screening for this, to start to shift practice patterns, so to include care related to these psychological factors. And as different medical schools try different ways of doing this in their training, in their delivery of care to their patient population, one is hopeful that this will grow.
Dr. Berg, we've been talking about angry people and how it affects their cardiovascular system in a negative way. How does anger affect the family, loved ones, friends of people who are angry? I have a sense that there may be negative consequences as well.
Yes, I mean, certainly it's the kind of thing that can affect relationships. It can, in extreme situations, extreme cases, lead to isolation, as people tend to steer clear of individuals who are so high hostile and so highly expressing of it in an angry kind of way. There's one researcher at Utah, Tim Smith, who has looked at things like this throughout his career in terms of how that way of responding can actually create a similar kind of response back, so that the hostile person is actually creating a hostile environment for themselves.
Which is the last thing they need, right?
Exactly. It's hostility begets hostility. We can think of this as this is a basic human emotion. It's there. It developed through evolution as a way of protecting the individual, the organism, because that that whole fight flight part of our stress response. If we are faced with a dangerous situation, responding in a way to meet that danger is sometimes the only thing available to us. And part of that is that strong emotion, which is part of that whole stress response. It's like even today, we're instructed depending on the type of predator animal we come upon when we're walking in the woods. We're supposed to do things to make ourselves look larger, make noise, things like that. I mean, this is part of that whole way of being. And if you carry that into, the non-threatening environment, but you're still responding in that way, you're doing that. That will be, the other people are responding to you being that way, and they're going to do the same thing. So it's yes, it's not good, and it doesn't help that person deal with their anger.
Let's imagine a situation where somebody has a heart attack and perhaps family members are aware of your research and say, yeah, Fred, he's an angry guy, and we don't want him to have another heart attack. Yeah, he's taking statins and he's doing all the things the cardiologist has recommended. He's even working out at the gym. But nobody has done much in the way of help Fred overcome that anger. So what's the importance and the role of family, friends, colleagues in helping heart patients recover from that heart attack, stay healthy, and calm down that anger reaction that may have contributed to the problem in the first place?
Well, I think that's a complex question. So partly it's about helping them stay calm, but if this is really an issue for a person, it's about being supportive of that person, doing work on their way of being, to disarm the anger, learning how to engage with the circumstances of the day in a way that doesn't provoke that response. It's that supportiveness. It's like anything around that heart patient. It's how do you get that heart patient to engage in regular physical activity if they've never done that before? How do you get that heart patient to eat a healthy diet when their diet has been defined by high fat, no vegetables, no grains, etc.? How do you get that heart patient to stop smoking when they've been a smoker for so many years? It's about being supportive, helping them see that this may be something that is contributing to their having had a heart attack, helping them see that living long and healthy is consistent with what's important to them, seeing their kids graduate, seeing their kids get married, seeing grandchildren, being around for all of that. And through that, helping them see that this is something for them to take on. And as we referenced earlier, there are many ways that are readily available, including, so many apps on smartphones these days that can help a person, learn a more stress-reduced way of going about their day, and in doing so to reduce their likelihood of experiencing anger when provoked by the daily events.
Dr. Berg, you have looked at anger and how it affects the body in a physiological, biochemical kind of way, in a negative fashion. And I'm just wondering if you or any of your colleagues have actually looked at risk factors like LDL cholesterol versus anger. Because I think a lot of cardiologists think that, they've got the hammer and it's statins, and it'll lower this one nail, LDL cholesterol. And, anger management seems like touchy-feely, not that important. But if you had the opportunity to address the American College of Cardiology and say, well, here's LDL cholesterol on this chart, and over here is anger, and how do they compare in importance?
Again, that's a great question. And, the idea that if the patient is taking statins on an antihypertensive to lower their blood pressure and whatever other medications are indicated after a cardiac event or to prevent a cardiac event, aren't they protected enough? I think that's a great question. Nobody has done that research to directly answer. However, there was one very large international study called the InterHeart study, and it looked at all kinds of risk factors for that we know contribute to the risk of a heart attack. And what this study found was that, number one, a factor that was defined by a whole host of psychological elements, including depression, stress, and the like, was as potent as a cause of heart attack as any biological factor, except for the genetic predisposition to hyperlipidemia. They also looked at anger, and they looked at anger in people who had hyperlipidemia versus not, high blood pressure versus not. It didn't matter what the risk factor was, anger added risk to it. And so, again, that's an observational study, which is different from a clinical trial type or an experimental study where you manipulate things intentionally to see what the effects will be. But the InterHeart study was a very powerful study, and the approach it took really sought to control for a lot of factors. And InterHeart found that regardless of risk associated with any of these other traditional cardiac risk factors, anger increased the risk above and beyond the risk associated with that risk factor. And that included hyperlipidemia.
Dr. Matthew Berg, thank you so much for talking with us on the People's Pharmacy today.
It's been a pleasure.
You've been listening to Dr. Matthew Berg, a clinical psychologist who studies the effect of stress on cardiovascular disease. He's professor of medicine in the section of cardiology at Yale School of Medicine, and he's author of Psychological Treatment of Cardiac Patients.
We turn now to a pioneer in the study of emotions and cardiology. Dr. Redford Williams is Professor Emeritus of Psychiatry and Behavioral Sciences at Duke University School of Medicine. His books, co-authored with Dr. Virginia Williams, include Anger Kills, 17 Strategies for Controlling Hostility That Can Harm Your Health, Life Skills, 8 Simple Ways to Build Stronger Relationships, Communicate More Clearly and Improve Your Health, and In Control. No more snapping at your family, sulking at work, steaming in the grocery line, seething in meetings, stuffing your frustration.
Dr. Redford Williams, welcome back to the People's Pharmacy. It's been quite a few years.
Nice to be here.
Dr. Williams, you are sort of the father of the field that I'll call emotions and cardiology and how they interact. And I'm curious, how did you get interested in this idea that anger can affect our health?
Well, I was very interested in psychosomatic medicine. In fact, as a freshman in a freshman seminar, the first paper we were required to write was the mind-body problem. And so as I've told people, I'm continuing to work on that paper topic. But,
After all these years.
in the 70s and 80s, it was very clear from the research that Friedman and Rosenman had done in type A behavior that there was really a reliable finding there. And I got very interested in that and actually invited Ray Rosenman to come and spend a week with us here at Duke, and he did. And we got to talking about it, and the aspects of type A were always in a hurry, fast talking, anger, aggressivity. And it seemed to me that it would be nice if the bad part was anger and hostility. And so there was a scale from the MMPI, Minnesota Multiphasic Personality Inventory, that was the hostility scale that Cook and Medley had developed. And it had 3 components: cynical mistrust of others, anger toward others, and aggressive toward others. And we were able to go back to some old studies that had MMPI done on them, and also some coronary patient samples. And we were able to show in several of these that the higher the hostility, the more severe the coronary atherosclerosis. And also in some other studies where patients had been followed up, that patients with high hostility had higher mortality and co-occurrence rates. So it was able to get going and really move along.
Well, I have to say, I think you had one of the best book titles of all time in Anger Kills. Very clear, very direct, really gets the point across. Why didn't people pay more attention to this message?
You would think they would. As time went on, there were many more studies that found that people with high hostility levels had larger increases in blood pressure when they were asked to recall a situation that had made them angry. They had lower social support studies, which is not surprising, and just all kinds of findings documenting over and over again that hostility and anger is bad for your health, especially your cardiovascular health. And that's why, if I may jump a little bit, to the paper that Shimbo and colleagues, including Matt Berg that you had on, found that in normal people who were asked to recall a situation that had made them angry or depressed or anxious or just asked to count to 100, that they had a very elegant, state-of-the-art measure of endothelial function.
Now, before you go another step, what do you mean by endothelial function?
I mean, endothelium is the lining of your arteries, especially your coronary arteries, where atherosclerosis leads to heart attacks and so forth, and sudden death. And this measure they had was a measure of how much this endothelial marker they had led to the artery getting bigger, dilating. And what they found was, as I'm sure Dr. Berg talked about, was that during anger, about 40 minutes after they recalled their anger, in the or their depression or their anxiety or counting to 100, the dilation, the endothelial dependent dilatation, enlargement, went up. But after the anger recall, it didn't go up nearly as much, suggesting that the anger somehow interfered selectively with the ability of that mechanism to let the artery get bigger. And it's nice if you're upset in a dangerous, stressful situation for your artery to get bigger so you get more blood to the heart so it can pump better and get you out of the situation. So this was very elegant evidence that anger is bad for your circulation in a very elegantly designed, scientifically very cool way. And that led me to think of a number of implications of that finding. First of all, wouldn't it be cool if they had a hostility scale score on these patients, all these healthy people, And wouldn't it be cool if in the anger recall task, the higher hostility people had the most failure to dilate compared to the low hostility folks? And that's what we found over and over again with the hostility scale predicting blood pressure reactivity after an anger recall task. In addition to that, wouldn't it be cool if they had just measured their blood pressure over the time and saw that in the anger recall task at 40 minutes, those folks had a higher blood pressure than the other three groups. And the higher blood pressure is just what you'd expected if they had high hostility, or the anger led to this failure for the endothelium to do its proper job to enable you to get more blood.
You're listening to Dr. Redford Williams, Professor Emeritus of Psychiatry and Behavioral Sciences at Duke University School of Medicine. His books, co-authored with Dr. Virginia Williams, include Anger Kills, 17 Strategies for Controlling the Hostility That Can Harm Your Health, Life Skills, 8 Simple Ways to Build Stronger Relationships, Communicate More Clearly, and Improve Your Health, and In Control, No More Snapping at Your Family, Sulking at Work, Steaming in the Grocery Line, Seething in Meetings, or Stuffing Your Frustration.
After the break, we're going to find out how people who usually react with anger and hostility can actually change their response.
Dr. Williams has a cool reminder. I am worth it.
Cognitive behavioral therapy, CBT, could reduce endothelial dysfunction.
Dr. Williams and his wife Virginia developed a life skills program to help.
The good news is, angry people can learn how to change.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is made possible in part by CocoVia, backed by 20 years of scientific research and the maker of the most proven and concentrated flavanol extract in the market today, Coco Pro Cocoa Extract. Cocoa flavanols are among the most studied plant-based bioactives today and are clinically proven to promote cardiovascular and brain health for the long term, supporting a strong heart and better memory.
Get 15% off your order of any CocoVia product by using the discount code PPOD15. Learn more at CocoVia, and remember that discount code is PPOD15.
These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by CocoVia dietary supplements. CocoVia Cardio Health is offered in both convenient capsule and powder formats, with each serving containing 500 milligrams of cocoa flavanols to support heart health. More information at cocovia.com.
Today, we're discussing how our emotions can impact our cardiovascular health. Do cardiologists learn about the negative effects of hostility on vascular function? If not, why not?
Our guest in this segment is Dr. Redford Williams. He's Professor Emeritus of Psychiatry and Behavioral Sciences at Duke University School of Medicine. Dr. Williams helped pioneer the study of negative emotions on cardiovascular function. His books, co-authored with Dr. Virginia Williams, include Anger Kills, 17 Strategies for Controlling the Hostility That Can Harm Your Health, Life Skills, 8 Simple Ways to Build Stronger Relationships, Communicate More Clearly, and Improve Your Health, and In Control, No more snapping at your family, sulking at work, steaming in the grocery line, seething in meetings, or stuffing your frustration.
Dr. Williams, I have to say that your research gave me a great deal of comfort. And the reason I say that is because I think my friends and associates and maybe even my family would agree that
Pleasant company included.
I have a type A personality. That is to say, I talk too fast sometimes, and I'm very energetic, and I'm always moving, and I'm doing more than I should. But I don't think that type A personality is very hostile. And hopefully, I have been shedding hostility over the decades so that now I'm trying to be a kinder, gentler, nicer person.
You've done a great job overcoming your cynical mistrust of other people, which you did start with.
It's true.
Congratulations.
Thank you. So this idea that people can kind of be evaluated for the angry, cynical, hostile aspect of their behavior, and they can perhaps just, really be more productive and, a little bit faster and a little bit more efficient. And that side of their personality might not be adverse for their heart. But the real question is, how can people who do have an anger problem, do deal with hostility, how can they begin to change?
That is a major implication of the study in the paper that we're talking about, that anger is bad for your heart. And here's a very sophisticated biological mechanism that documents how anger gives you this bad aspect. So it's a very strong implication that we should learn how to reduce and manage our hostility and anger better. And that was one of the major goals of Virginia's and my Williams Life Skills Program. And just to give you a quick example of how you do this, if somebody bothers you, say Terry says, "You're stupid for wanting to have raisins in our salad tonight," and you get angry as all get out. How she's just stupid too. Well, before you do anything, say, "Well, you're stupid too," do this. Ask yourself 4 questions. Is this an important situation? If not, cool out, chill out, practice meditation or something. Second question, is my anger appropriate here? You only go to the second question if the first answer is yes. And would it be appropriate if she says that to you to get a little bit angry? Well, probably so. And then the third question is this situation modifiable? Should I be able to get her to quit telling me I'm stupid for suggesting things to put in the salad? And the answer is that yes. And if the answer to any of these is no, you practice meditation, self-talk, reasoning. Hey, this is not that important, and so forth. And then the last question, would it be worth it to take the action necessary? And if you get a yes to all 4 of those questions, in this situation, it would not be to bang at her and curse her out. It would be to practice asking her to, assertion. So, honey, could you please not use the word stupid when I suggest raisins? It just really kind of gets me upset. I'd really appreciate it if you could do that. And if it's not a person's behavior, but it's a situation, Virginia and I are trying to find a parking place over in this garage. How are we going to do it? Well, then you're angry and upset over it, but you can't assert thing. You've got to problem solve. And that's what we kept going around till we finally found a place to park. Now, the way you remember these 4 questions whenever you're angry, important starts with I, appropriate starts with A, modifiable starts with M, and worth it. I am worth it. I am worth it. And you are worth figuring out whether you need to do something or chill out.
What I love about that is that it does recognize that there are times when anger is what you need.
Yeah.
When anger is telling you you need to take action.
Yeah.
But you do have to evaluate that this is the time when anger is appropriate, when it's important, when the situation can be addressed, and that it is actually worth taking action.
Absolutely.
Well, it's that worth it that is so critical, that last step.
Yeah.
Because a lot of times you can get all three, but that worth it is like, that probably is going to cause me more harm than good.
Yeah.
Maybe I should just chill.
Yeah.
Although starting with important is a great place to start, because if it's not really worth it, it might not be important.
Yeah. And you can probably figure out things when it wouldn't be worth it to take action, like to give more money to one or two of the political parties, et cetera.
Right.
Kind of. Well, don't want to get into that, but anyway.
Yeah, but exactly.
But the point is that there have been randomized controlled trials done according to standard procedure, using the cognitive behavioral-based interventions, usually on a group basis. And they'd actually discuss one of these or cite one of these in the paper, where cognitive behavioral intervention to reduce anger actually reduced the endothelial dysfunction. And there have been loads of studies that use cognitive stress-based behavioral stress interventions in groups that show that it reduces blood pressure. An elegant study in Singapore by Bishop et al. Found in men with coronary heart disease randomized to either the life skills cognitive behavioral stress management program or waitlist, that hostility went down in the intervention group, but not the control. And resting blood pressure went down. But also blood pressure and heart rate reactivity to the anger recall task in those who had gotten the training actually got smaller. But in the control group, if anything, it went up a little bit. And so here's evidence that anger recall task, after an effects on your blood pressure and your heart rate, and probably your endothelial dependent vasodilatation, went down after the training. And also, another example was the ENRICH study, Enhancing Recovery in CHD, a major National Heart, Lung, and Blood Institute sponsored study, multi-million-dollar study, multi-work sites around the country. And it found that, and the design was to have individual psychotherapy in depressed or socially isolated patients, to have them then go into the cognitive behavioral stress management program, group-based, and to see if that reduced their mortality or recurrent coronary events. And overall, the whole study failed to show a clinical benefit in either mortality or recurrent decrease. However, as it turned out, everybody got the individual psychotherapy first, and then were to go into the CB, cognitive behavioral group intervention. Well, as you can imagine, at all the centers where this was being done, they couldn't get enough people post-MI to get to form a group. And so the number of people who got the individual was maybe 1,000, and those who got the individual plus the group base was maybe 600, so it was a decrease. But we did an reanalysis of the data, looking at the patients who got both the individual and the group-based cognitive behavioral intervention versus those who got only the individual therapy, as well as the control group that got nothing. And in a paper published sometime after the main paper, and Dr. Berg was a co-author of this paper along with me and others, we found that the group who got the cognitive behavioral group, in addition to, as well as the individual, had a significant reduction in the mortality and recurrence event. But when we redid the analysis controlling for the fact that the behavioral intervention group had survived longer already, the p-value went from 0.00 something to 0.11, not quite significant. But we still were very encouraged by that shows, along with all the other studies showing the benefits of this kind of intervention, that is a very strong case that this kind of intervention is going to help people who've had a heart attack. And there are also papers reporting people who were studied as children and are younger folks and were followed up over time, that they had decreased cardiovascular risk factors after this cognitive behavioral stress management type of intervention.
So there have been studies that have offered the various life skills approaches that you've developed to children. I'm loving the idea that you're not stuck with your personality. So if you have had a problem with anger, you don't have to always be an angry person who's having problems.
Right. And indeed, there have been studies with our life skills program, Williams Life Skills Program, in children in Georgia, fifth graders or so, and showed benefits in terms of reduced anger and hostility. And I don't recall if they got blood pressure or not. But anyway, also we've adapted our program in China, and there have been studies that showed that the intervention in left behind children was beneficial for their psychological health, and also in youthful violent offenders in jail, that it was also beneficial for their anger and hostility and so forth.
So, Dr. Williams, you have made a very strong case, as have your colleagues, that controlling anger, modifying hostility, changing the way we interact with the world can make a huge difference in cardiac function, in the flexibility of our blood vessels with regard to our blood pressure, and can have outcomes that we care about.
Yeah.
Fewer cardiac events, fewer deaths. Why haven't your cardiology colleagues embraced this idea and said, well, along with your atorvastatin to lower your LDL cholesterol, we want to test you.
Or your beta blocker.
Or your beta blocker. We want to test you for your hostility, anger, psychological profile. And if you score high, we recommend that along with whatever pharmacological interventions, you might benefit from a little cognitive behavioral therapy or some group.
And all this evidence that it has very good benefits.
So why haven't your colleagues, your cardiology colleagues, and cardiologists all around the world embraced the Williams concept that anger kills?
And others have also developed these kinds of things. It's basically the cognitive behavioral stress management is been shown over and over again to be beneficial. And as we've just been discussing, there's evidence that it's good for your heart and your blood vessels and your blood pressure and so forth, with reducing a psychological personality factor that's already been shown to be a high risk factor, not out of line with the high cholesterol and so forth. Why haven't the cardiology field, why hasn't it adopted these approaches? And I guess I don't know the answer. There may not be an answer, but I would think that maybe what we need to do, one way to deal with this would be in medical schools to have more of the educational content to deal with these issues, because these are not just psychological stuff.
It's not touchy-feely soft science.
Yeah. There's evidence.
It's really based on evidence that's been published in papers like JAMA and the American Heart Journal and so forth. In fact, the Bishop paper I told you about, where the life skills training reduced their blood pressure reactivity to anger recall, was in the American Heart Journal.
So if you were in charge what would you tell the cardiologists of the world that this approach could be beneficial along with whatever else they recommend?
I would tell them all, here's the evidence that hostility and anger and depression and social isolation and loneliness, as our Surgeon General has made a very strong point, are bad for your physical health as well as your emotional health. And there is beginning to be, and also, as the paper we've been talking about for this program, there are actually very elegant, sophisticated biological mechanisms that have been identified that could account for these harmful clinical effects. And there's also this evidence that interventions that reduce these hostility and these psychosocial factors that are bad for your health improve the possibility. We need more of those studies to make this case stronger, but the evidence that's already out there is very encouraging. And so I think we just need to hit the medical student body with this information and involve them in some of the research that's going on about all this. And also just keep on publishing papers in very high-quality journals that document these things. And maybe we could make the case at some point that, as is becoming, I think, more the case in China, for example, that all middle school students or junior high students need training in these cognitive behavioral skills. Another one in our life skills program is listening. We have an exercise where for 5 minutes you talk about something that matters to you. And you, Joe, have got to sit there and look Terry in the eye and nod your head, but don't intervene with a comment. I don't think I would agree with what you just said. When she finishes, at the end of 5 minutes, you say, honey, I think what I heard you say is that you really get upset when I tell you how to cook a salad or make a salad by adding raisins to it. I'll try to not do that in the future. And then you get to listen to him for 5 minutes and reflect back what you've heard him say. Learning how to understand, to hear what other people are saying. If the Republicans and the Democrats could engage in this exercise and really hear what the other person is saying and reflect back, maybe we would not be in as much trouble as we are today.
It is a powerful technique. Dr. Redford Williams, thank you so much for talking with us on the People's Pharmacy today.
Thank you for listening.
You've been listening to Dr. Redford Williams, Professor Emeritus of Psychiatry and Behavioral Sciences at Duke University School of Medicine. Dr. Williams helped pioneer the study of negative emotions, especially anger, on cardiovascular function. His books, co-authored with Dr. Virginia Williams, include Anger Kills, 17 Strategies for Controlling the Hostility That Can Harm Your Health. Life Skills, 8 Simple Ways to Build Stronger Relationships, Communicate More Clearly, and Improve Your Health. And In Control, No More Snapping at Your Family, Sulking at Work, Steaming in the Grocery Line, Seething in Meetings, or Stuffing Your Frustration.
We spoke earlier with Dr. Matthew Berg, professor of medicine in the section of cardiology at Yale School of Medicine and author of Psychological Treatment of Cardiac Patients.
Lynn Siegel produced today's show. Al Wadarsky engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
The People's Pharmacy is made possible in part by CocoVia dietary supplements. Cocoflavanol supplements that support cognitive and cardiovascular health, made with a proven concentrated flavanol extract. More information at cocovia.com.
Today's show is number 1405. You can find it online at peoplespharmacy.com. That's where you can share your comments about today's show. You can also reach us through email, radio@peoplespharmacy.com.
Our interviews are available through your favorite podcast provider, including YouTube Music. You'll find the podcast on our website on Monday morning. This week, our podcast has additional information on how anger can affect the family and loved ones of those who are angry. How can cardiologists recognize biological factors beyond cholesterol and embrace evidence-based therapeutic interventions to address hostility?
At peoplespharmacy.com, you can sign up for our free online newsletter to get the latest news about important health stories. When you subscribe, you also have regular access to information about our weekly podcast, so you can find out ahead of time what topics we'll be covering. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.